Good morning, I'm Christine Joyce Comisario and I will be performing sterile gloving. So first thing I need to do is the assessment. So number 1, let us consider first the type of procedure to be performed. Number 2, consider patient's risk for infection. Number 3, select correct size and type of gloves. Examine package to determine if it was dry and intact with no water stains. And then number 4, inspect condition of hands. Determine if there is a lesion, presence of lesion, and then prevent participation in the procedure. And then lastly, the number 5, assess patient for risk factors before applying latex gloves. So let us assess first the previous reaction to other items containing latex, and then the personal history of asthma, and then history of food allergies, then the previous history of adverse reactions during surgery or dental procedure, and lastly, the previous reaction to latex products. And the next thing we need to do is the planning. So let us identify the expected outcomes. So let us now proceed to implementation. Apply the gloves. So first thing we need to do is perform thorough hand hygiene and then place the glove near work area. So let us grasp inner package. So remove outer glove wrapper by peeling sides apart. And then grasp inner package on appropriate workplace. And then open package. Keep gloves on inside surface. So let us not touch the inside surface of the package. And then let us now identify the left and the right glove. So grasp glove for dominant hand by touching only glove's inside surface. And then pull over dominant hand. Ensure cuff did not roll up wrist. And then next is slip fingers under cuff of second gloved hand with dominant hand. And then next is pull second glove over non-dominant hand and then interlock hands once both gloves were on. Then hand held away from body until beginning procedure. So, and then next is perform the procedure. And then next one is remove the gloves. So grasp outside of one cuff with other gloved hand. Then avoid touching wrist. And then pull glove off by turning it inside out. And then place glove in gloved hand. And then place fingers of bare hand inside of remaining glove cuff. Then peel glove of inside out and over previously removed glove. And then discard both gloves in receptacle. So next one is let us now perform the thorough hand hygiene. The next thing we need to do is the evaluation. So number 1, assess patient for signs of infection. Number 2, assess patient for signs of latex allergy. And then lastly, number 3, identify unexpected outcomes. And then of course, let us not forget to record and report. So number 1, record any patient response indicating a latex allergy. That's all. Thank you. So, good morning, I'm Christine Joyce Comisario and I will be performing the gowning and the gloving. So first thing we need to do is lift the sterile gown and step back from trolley so as not to contaminate the gown. And then don gown by placing hands on the sleeves taking care not to contaminate hands and arms. Do not raise hands above shoulders level and drop the low waist. So allow gown to be flattened prior to don gloves. Then keep hands inside sleeves of gown at all times. So open glove pocket and lift first glove by cuff. And then place an opposite hand and forearm with them facing downwards and fingers pointing upwards. So repeat the process for opposite hand. Once the second glove is done and gown is cuffed, it can now be adjusted. So we can now adjust the glove and the gown. So this is the process on how we put gloves and gown. So let us now proceed in removing the gloves and the gown. So circulating practitioner should undo gown at the back. Pull gown shoulders downward over arms and then roll gown to avoid nation and discard safely. Also, remove gloves by taking care not to contaminate hands. Remove gloves, taking care not to contaminate hands. And do it in the other hand. Repeat the process on the other hand. Then, once glove has been removed, discard safely and then perform hand hygiene. Thank you.